This segment of Good Company was sponsored by Akron Children's.
If your child has a heart issue, you want help healing it. Friend of the show, Alexa Lee, traveled to Akron Children's, where she found a promising procedure that offers hope.
Today I'm back at Akron Children's, where we are discussing yet another new technology and procedure leading the way here at Akron Children's. It's no different. We're talking about cardioneuroablation with Dr. John Clark, and this is absolutely fascinating, and it deals with heart and arrhythmias, right?
Right.
So what is CNA, as it's referred to?
CNA, cardioneuroablation, is a type of catheter ablation procedure. Catheter ablation involves putting wires in through the leg veins, threading them up to the inside of the heart, and cauterizing a certain area of the heart. It's been available for over 30 years to treat fast heart rates. We find the area that's causing the heart to beat too fast and cauterize that area. What's new about CNA is, for the first time, we're using the same procedure to treat heart rates that are beating too slow. And we can increase the heart rate rather than decrease the heart rate.
Fascinating. So if folks are listening to this at home, maybe they've been dealing with this issue for a number of years, and they're thinking, maybe this is a good opportunity for me to come in. Who's a good candidate for this procedure?
There are two primary groups of candidates. The first is a group of patients who pass out recurrently and treated medically, and it's not succeeding, and they're continuing to pass out. And if they pass out because their heart rate is too slow, they are candidates to have this done to potentially improve or fix the problem. The other group of patients are patients who have a pacemaker but don't pace all of the time. They only pace intermittently. They are patients who may benefit from this procedure and may be able to have their pacemaker removed.
Well, we know that Akron Children's leads the way on so many new procedures and technologies, and truly, you doctors are amazing. You blow my mind every time I come. And again, it's no different here. So how is Akron Children's at the forefront of this new technology?
We've been at the forefront really through the whole thing. We weren't just the first hospital on how to offer this procedure, but we are also the only hospital in the world offering it without radiation exposure. And that's something that we developed back in 2005 and have taught the pediatric world how to do it. In the adult world, they're not really adapting it much. But radiation exposure follows that patient their whole life and carries a lifetime risk of cancer. And so, since our patients are younger, anywhere from newborn to 40 years of age for this procedure, it's much more important that we minimize or eliminate any radiation risk. And so we've done that. We've taken our background and adapted it to this new technology and have married the two. The other thing we do is the heart is caused to be too slow because of its abnormal response to the vagus nerve. And so there are four primary areas that we ablate, that we can ablate, and most people just go in and ablate all four of those areas. We tune the whole procedure to just what's needed because we can test the vagus nerve, test the heart's response to it, and when we've ablated what we need to, we're done. And sometimes that means it's just one spot, so we don't do any more than we need to, nor any less, and that's fairly unique to Akron also.
Amazing. Well, it sounds like CNA is really changing the landscape for everything in electrophysiology, and Akron Children's, again, is leading the way. Dr. John Clark, you are wonderful. Thank you so much for everything that you do for all of our children and for us. And for more information for folks at home, you can just go to akronchildrens.org.